Kuya. Nganong ga-exercise mga karon sa iyong buntaga? So gatuloy kag healthy respiratory system gives you a healthy body. Okay.
The respiratory system moves air through the nose, pharynx, larynx, trachea, and bronchus to the alveoli where the gas exchange between oxygen and carbon dioxide occurs. Nares are the openings to the nose. The nasal cavity is lined with cilia, mucous membranes, and blood capillaries. The air is filtered by cilia, moistened by mucous membranes, and warmed by the blood. Air moves into the pharynx or throat, the common passageway for food and air. Air continues on to the larynx. The epiglottis, a flap of tissue in front of the larynx, closes off the larynx when swallowing to prevent food from entering. The larynx or voice box contains the vocal folds. The trachea or windpipe connects the larynx to the bronchial tree. The cartilage rings of the trachea prevent the trachea from collapsing. Lungs are spongy tissue with alveoli and blood capillaries. Breathing occurs because of the expansion and contraction of the lungs. The bronchi carrying the air subdivide into smaller branches called bronchioles. At the end of each bronchiole are the alveolar sacs. The alveolar sacs are surrounded by blood capillaries and contain millions of single-layer alveoli cells where the gas exchange takes place. Oxygenated air goes from the nose to the pharynx, larynx, trachea, bronchus, and alveoli. By the process of diffusion, oxygen in the air moves from the alveoli to the capillaries. Carbon dioxide moves from the capillaries to the alveoli and is exhaled. This process is called respiration.
All cells need oxygen. It is the essential fuel which is necessary to enable cells to stay alive and to carry out their various activities. Bringing oxygen to the cells requires the uptake of oxygen from the air in the lungs, its transportation in the blood, and its delivery to cells all over the body. The first step is the taking up of oxygen by blood flowing through fine capillaries in the walls of the lungs' air sacs, or alveoli. The oxygen molecules change from their state as a gas freely circulating in the air, dissolving into a solution in the plasma within the capillaries of the alveoli. Once in the solution of the blood, 98% of this dissolved oxygen is taken up by passing red cells, leaving just 2% remaining in the physical solution unattached. Red cells are particularly well suited to transporting oxygen because they contain a special oxygen-binding protein known as hemoglobin. Each molecule of hemoglobin itself contains 4 molecules of heme, an iron-containing pigment, which binds oxygen loosely and reversibly. Hemoglobin that is fully saturated with oxygen is bright red and is called oxyhemoglobin. On the other hand, hemoglobin that is not saturated with oxygen is purplish blue in color and is called deoxyhemoglobin. It is heme which makes it possible for the red cells to pick up oxygen dissolved in the blood, transport it combined with hemoglobin, and release it back into the blood as oxygen in solution, ready for delivery to the various cells of the body. Hemoglobin gives up its oxygen as red cells travel through capillaries in tissues where there is a low content or partial pressure of oxygen. The partial pressure of oxygen represents the level of dissolved oxygen in plasma. As oxygen is released and again is carried in solution, the partial pressure of oxygen in the capillaries becomes greater than the partial pressure of oxygen in the surrounding tissues. This causes oxygen to move out of the capillaries into the tissues and to finally reach the cells. This graph, the oxygen dissociation curve of hemoglobin, shows why hemoglobin is particularly suited to its role in transporting oxygen. The oxygen dissociation curve demonstrates the relationship between the oxygen carried in combination with hemoglobin, the O2 saturation, and the partial pressure of oxygen in the arterial blood. The sharp upstroke and the flat plateau illustrate how oxygen is released to the tissues over a wide range of conditions. Its shape means that although the partial pressure of oxygen in the blood returning from the lungs and being pumped out by the arteries may be reduced to only 50% of the normal value, say due to lung disease or high altitude, hemoglobin will still be 85% saturated with oxygen.
The primary muscle of respiration is the diaphragm. The diaphragm is a thin, dome-shaped layer of muscle and tendon that separates the abdominal cavity from the chest cavity. It gains its shape from its attachments and from the organs that surround it, especially the heart, lungs, and liver. The diaphragm attaches at the costals along the lower rib cage, high in the front at the sternum, and deeply in the back along the spine. The diaphragm also attaches to itself via a central tendon, making the diaphragm one of the unique muscles of the body. The diaphragm uses its central tendon and its attachments as leverage to flatten during inhalation. The expansion of the ribs comes from the resistance of the internal organs to downward movement. As the internal organs are slow to move, the ribs expand to make room for the lungs. While the diaphragm attaches at the bottom of the ribs, its range of motion never reaches that low in the body. As seen from below, we get a sense of the full range of motion of the diaphragm as it would glide over the aorta, the vena cava, the esophagus, and the internal organs. For more information, visit www.3dyoga.com.
Asthma is a chronic long-term condition that can be managed but not cured. Asthma affects the airways of your lungs. It causes the airways to narrow and swell, resulting in wheezing and difficulty breathing. During breathing or respiration, air goes in through our nose or mouth to the upper airways, at which point it reaches the windpipe, which branches into two large bronchi to reach the lungs. The lungs are protected by the rib cage, which also contains the muscles that control your breathing. In asthma, the airways are oversensitive and easily irritated by certain triggers, called asthmatic triggers. Most people with asthma are described as atopic, meaning they have an allergic type reaction to external triggers, such as house dust mites, pollen, cigarette smoke, animal fur, and chest infections. However, for some people, the onset of asthma is unpredictable and may be caused by anxiety, stress, or even laughter. An asthmatic trigger causes the airway walls to swell and the muscles around the airways to contract. The airways narrow, and breathing through them produces a whistling sound called wheezing. Mucus is produced from the lining of the airways, which clogs up the narrowed airways further and causes coughing. This makes normal breathing more difficult, producing symptoms of asthma that can be mild, moderate, or severe and life-threatening, where hospital treatment is needed. The narrowing of the airways is reversible if the trigger is removed, or if the inflammation is treated medically. Therefore, preventative treatment is used and can be managed by the patient themselves. An acute asthma attack requires medical intervention, but the type of intervention depends on the severity of the attack. For more information, visit www.nhs.uk.
The lungs are the primary organ in respiration. They are sponge-like organs that are divided into lobes. Although the right lung has 3 lobes, the left lung has only 2 lobes due to the position of the heart, which is toward the left side of the body. During respiration, air travels through the nose, down the trachea or windpipe and into the bronchus. The bronchus branches into narrower bronchioles and then into smaller and smaller airways, ending in air sacs called alveoli. It is at the alveoli that oxygen is exchanged for carbon dioxide. Most cancerous changes occur in lungs long before any symptoms are present. There are many types of lung cancer, but the most common lung cancer is bronchogenic carcinoma, which begins as a tumor in the lining of the bronchi. Lung cancer can also be present in the trachea, the bronchioles, or the alveoli. Lung cancer is the leading cause of cancer deaths among men and women. But the most alarming news is that more women will die from lung cancer than will die from breast cancer. Cigarette smoking poses the greatest risk for developing lung cancer.
Sa buhay nating ito, di natin alam kung kailan darating ang panganib. Ang mabagsik na sakit na TB ay makukuha mo sa di inaasahang pagkakataon. Para tuloy ang ligaya, umiwas sa karamdaman. Makipag-ugnayan sa TB Network sa pinakamalapit na health center.
What if you could see what cigarettes were doing to your insides? What if you could sit back and watch your lungs slowly blacken and wither? Or your heart enlarge as it struggles to keep you alive? What if you could see the cancer garden growing every day just beneath your skin? Would you still smoke?